Good morning, and thank you for joining us for this 165th coronavirus update. Orange County Mayor Jerry L. Demings will be discussing the latest positivity rates and how this will play into his vaccine directives. The mayor will also be updating you on where to get tested and get booster shots and where you can find the I Got My Shot mobile trailer. And the mayor will also update you on the latest locations for our redistricting meetings. After that, Dr. Raul Pino will not be here today because he had to attend a meeting. However, Mr. Kent Donahue, who is the spokesperson for the Department of Health in Orange County, will be here for the latest numbers. And now, Mayor Demings.
Thank you, Jane. Thank you to all of you for being here this morning. As we begin, just want to recognize several people who have joined us today. We have Mr. Scott Howard from the Orange County Public Schools is here. We also have Dr. Yolanda Martinez from our Orange County Health Services and our HR Director, Ricardo Day. Ms. Ilio Torres is here to assist if there are any questions in Spanish and translation is needed. As we begin this 165th news conference since the coronavirus pandemic began in March of 2020, I do pause today to acknowledge that literally I just came from a funeral service for one of our corrections officers who unfortunately passed of COVID-related illnesses. And had the opportunity to meet his family, speak with them, and the other correctional staff who work at our Orange County Jail on a day-to-day basis. And I'm reminded that the battle that we have been in with COVID is still real. And so for all of those individuals who ask, why do I make the decisions that I make those decisions because I do truly put life, health, and safety of our employees and our citizens first here within this community. And if I could have done anything to preclude that officer from getting COVID-19, I certainly would have done it. Not sure how he got it. If a co-worker who was unvaccinated brought it into work and gave it to him or not, or some other citizen. This is the struggle that we have as a society, as a free society. So we have done and made decisions that was designed to reduce the possibility of the transmission of the disease amongst our employee here in Orange County. And so I will not back away from the obligation that I have to our employees and to our community to make sure that as we provide service in this community, that we do so in the safest manner possible. That corrections officer did not really have the choice whether he would go to work at the jail or not. We don't have the choice of whether we run a jail or not. We're required, constitutionally required, to fund and manage a jail here within Orange County. And so when we send our employees into potentially harm's way, we have to do everything that we can to protect those employees in the process. So it's not lost on me that it has been a long 19 months with many obstacles along the way, but our community has always rallied and has faced every challenge head on. We've seen the transmission go up and down over time. This last wave of COVID cases that began in late June made for an extremely challenging time for everyone, including hospitals and emergency officials. You may remember that in August, the Delta variant claimed the lives of some 410 of our residents and continues to claim lives even today. As the spread of COVID-19 was getting deadlier, I signed an executive order declaring a state of local emergency on July the 28th, nearly 3 months ago to the day. Thankfully, due to the high number of vaccinated residents and the wearing of masks and other safety measures that have been put in place here in our community, our numbers have plummeted. In fact, the 14-day positivity rate is recorded at 3.51%, making the rate at 5% or below for 17 consecutive days in a row, 17 days since October the 11th. Due to the low positivity rate, I am pleased to announce that I am allowing the executive order to expire this afternoon at 3:04 p.m. so that we will no longer be under a state of local emergency. While this may be good news for some, if there would ever be another deadly wave of cases here within our county, I reserve the right to put the executive order back in place to make sure we do everything possible to slow the spread. I hope that will never happen, but we don't know precisely what this virus is capable of. So what does it mean when the executive order expires later today? First of all, I want to remind everyone that there is not a countywide mandate in effect. That's because the governor suspended all local COVID emergency orders back in May, effectively negating them. It will be up to individual employers to decide how they want to keep their patrons and workers safe. As for the Orange County facilities, we will continue to require the wearing of facial coverings for county employees until the CDC moves our county from substantial risk of transmission to moderate. That means when indoors in our county facilities, our employees will be required to wear facial coverings. When they're outdoors, that's another story. They will have to make decisions for themselves in that regard. I want to take this opportunity to thank our residents for taking the pandemic seriously by getting fully vaccinated, wearing masks, and following other safety protocols. You, our community, have demonstrated how much you care for your families, your friends, and your neighbors. Your unselfishness is why Orange County is such a great place to live. Now, here are the latest numbers. According to the Florida Department of Health, there are now 232,110 coronavirus cases reported in Orange County. The number of Orange County residents who have died from COVID-19 has now reached 2,178 deaths. That's 34 additional fatalities since we last met. Our hearts continue to go out to all of the families of the victims of COVID-19. As I started out, one of them most recently is one from our very own Orange County family. As I mentioned, our 14-day positivity rate is at 3.51%. It is the 17th consecutive day that it has been below 5%. Now let me give you an update on our vaccine opportunities. The I Got My Shot vaccine trailer is still moving around the county. The mobile trailer only has Pfizer and Johnson & Johnson vaccines. At this time, it does not have Moderna available. And the only booster shot available at the mobile trailer is the Pfizer booster. If you want to mix brands, get a Moderna shot or get a Johnson & Johnson booster, you will need to go to the Barnett Park vaccination location. The mobile trailer is located right now at Chick-fil-A on Sand Lake Road in Orlando. It will be there today until 2 p.m. Tomorrow, it will be at the Goodwill in Waterford Lakes from 9:30 to 11:30 a.m. All of this information can be found at ocfl.net/IGotMyShot. In terms of testing, there are still 2 county-run sites that offer free COVID tests 7 days a week, but the Econ Soccer Complex will close after Sunday. The Econ site is open between the hours of 9 a.m. and 4 p.m. Starting November the 1st, Barnett Park will be the county's sole testing site, and it will be open between the hours of 9 a.m. and 5 p.m. Testing remains important to all of us as we continue to live through this pandemic. Those who desire to know their status should have the opportunity to be tested. You can thank your local government, Orange County, for that site. Our health services employees have stood out in the cold, the rain, the heat for months now, offering testing, vaccinating people who desire to get vaccinated in our county. We thank them. We want to remind residents who are struggling with their rent because of the pandemic, there is help available through our emergency rental assistance program. To date, 2,214 families have qualified for help with their rent and have avoided eviction. More than $11.9 million have been approved for distribution to those families. Residents who want information about rental assistance can go to ocfl.net/rental assistance. We continue to have our advisory committee for redistricting move throughout the county to ensure that people have input into the new county district boundaries that will be drawn. The next meeting will be at Colonial High School on Monday evening at 6:30 p.m. For more information on our redistricting efforts, you can go to ocfl.net/redistricting. And now we'll transition. I want to talk about our animal services. You know, our pets have made a difference to help us get through this pandemic. I can tell you my 99-year-old father had a special relationship with his dog called Rage. During the lonely times, that dog was there with him. And so before we go to the Department of Health, we want to make an appeal to you. Orange County Animal Services is at capacity for its dogs with 174 canines in the shelter's care. And there are 124 cats that are also at the shelter. Right now, there are 35 dogs available for immediate adoption to go home with new families, including Lockie, who is on the screen behind me. To see all of the adoptable pets, you can go to ocnetpets.com. ocnetpets.com. And now I'm going to turn it over to Mr. Kent Donahue from the Florida Department of Health in Orange County for additional comments.
Thank you, Mayor. Good afternoon. As he mentioned, my name is Kent Donahue. I'm the Public Information Officer for the Florida Department of Health in Orange County. I'm filling in for Dr. Pino today. Since the beginning of the pandemic, our total positive cases of COVID here in Orange County is 232,110. We still see our trend going down in terms of the percent positive. Currently, as Mayor mentioned, the 14-day rolling percent positive average is now at 3.51%. Unfortunately, since our last meeting on the October the 21st, we've had 34 additional fatalities related to the virus reported to the Florida Department of Health in Orange County. We certainly send our condolences to the families and friends. Of that total, 16 were female, 18 were male. There were 19 white, 12 black, and 3 other. There were 13 Hispanic, 18 non-Hispanic, and 3 unknown. Our current total is 2,178. Items of note, 2 previous deaths assigned to Orange County have now been transferred to Seminole County. And one of the previous deaths was a duplicate, which has been removed. As you know, we always continue to clean the data. Of that 34, 10 had known underlying health conditions, and 24 had unknown health conditions. 1 date of death is from August of this year. 16 dates of death are from September, and 17 dates of death are from October itself. 4 of the 34 deaths are reported from a long-term care facility itself. As Mayor Demings mentioned, we still remain in the orange status for transmission from the CDC. Hopefully in a couple of weeks, we're optimistic we'll hopefully move down from orange, which is substantial, to moderate, which is yellow, and below that is very low transmission level. And finally, just a couple items. We certainly encourage everyone to follow us on Twitter for our updates and any additional events and activities we actually hold here at the Florida Department of Health in Orange County. So follow us at Twitter at DOH-Orange. Mayor?
All right, thank you, Mr. Donahue. We will open it up for any questions at this time, and just in terms of protocol, there will be a microphone that will be moving around, and we will respond to questions in the order in which they are asked.
Thank you, Mayor Demings. Lauren Cervantes from WKMG News 6. What message are you sending to Orange County Public Schools, and what does it mean regarding their decision tomorrow that's expected on the mask mandate? When you let the EO expire, removing the state of emergency, but you keep masking at county facilities, does that send a mixed message? And have you spoken with Superintendent Jenkins?
I don't see it as a mixed message. You know, I don't speak for the school district. That is the responsibility of the elected school board. Certainly, Mr. Howard can respond to the question about what the school district may or may not do. The decisions that we have made here, we have been really clear that all along that once we got to below the 5%, that we would likely make some adjustments in terms of our state of emergency. Historically, that's what we have done in the past. So in many ways, our public can expect what kinds of actions that we're going to take. You know, what I've done today is also give the public additional guidance and suggestions about where we're headed in the future and when we will make additional modifications. So for our employees here within Orange County, we still have to serve the community, and we have to do so knowing that the virus is still in our community. People still contracting the disease. Our employees are continuing to contract the disease. And I think I was clear today that we had a funeral today. So because of that, there's no time for us to relax and say that things are over. No, people still have a responsibility to act in the safest manner that they possibly can. So for the school district, I think they have to make some decisions regarding their employee. I think it was exceptionally good news to hear today that the Food and Drug Administration has approved the opportunity for children between the ages of 5 and 11 years old to get vaccinated. I know there's some final approval that has to be done within the next few days that will likely happen. So I think that's good news for parents who are concerned about their children. We know that not all parents are going to immunize their children. They will do a wait and see, but we hope that for the teachers and other employees who work within the school district and the students, that's good news for Orange County Public Schools. That's good news for our community as we endeavor to get the overall rate of those vaccinated in our community up. I believe the solution to significantly reducing the potential spread of the virus in our community rests within our ability to get more people vaccinated. That's what the science says. I know there are the detractors who are out there who advocate otherwise, but for every qualified person that I speak to, they are unanimous in that what we're doing is the appropriate course of action as a community. So I believe that our community is doing as well as it is because people have made sensible decisions, and we look forward to our community continuing to be responsive to the guidance that we're offering. Scott, is there anything you want to add about the school district on that? Maybe he does.
Thank you, Mayor. You said it very well. The superintendent was pretty clear last night that it's not one indicator, it's many that we'll be looking at and she's looking at today. This was one piece of it to see where the mayor was heading today as far as the emergency order, talking to our local health officials that she's relied on throughout the pandemic, discussing with them. Speaking with the school board is going to be important for her. Talking to each one of the board members individually about where we are. The data that Mr. Donahue shared with us today was important because we'll continue to look at that. So it's looking at all of those things and taking them in total into consideration as we look and move forward. The priority for us is always the health and safety of our children and our staff. We want to make sure that they are safe as we move forward. We certainly are encouraged by the direction of the data, and we're very encouraged by the approval of the 5 to 11-year-olds to start receiving the vaccine, and we hope that that'll happen sooner rather than later, and that parents are talking to their medical providers right now about getting that vaccine, because the sooner we can do that and move in that direction, the safer our entire school system will be. So thank you for the question. Thank you, Mayor. I appreciate it.
Mayor Demings, thanks for taking the questions. Marley Martinez with WESH 2 News. Two questions for you. Number one, at 3:05 p.m., what changes for people who live in Orange County who are not county residents? And second question for you, you said that you reserve the right to reinstate the executive order if needed. So what is the threshold for when that could happen? Would that be when we hit 5% positivity rate again, or if?
Well, again, when I make the decision to go in the state of emergency, there are multiple things that go into that decision. One is if we're at a very high rate of transmission. Number two, if we see capacities within our systems of care, within our hospitals, being close to capacity or exceeding capacity, that goes into that decision. If the death rate suddenly begins to climb, all of that goes into it. I will tell you that what changes at 305, one of the nuances that we have with our labor force is that, remember, all of our unions entered into an agreement with the county regarding the vaccine mandate for our employees. What it means for them also is that those who refuse to be vaccinated by the deadline received a written reprimand, and they were required to do weekly testing. Pursuant to those labor agreements, they will no longer be required to do weekly testing, but they will be required, depending upon their work location, they may be required to wear masks while indoors and outdoors. If you're a healthcare worker, and many of our firefighters, for example, are EMTs, emergency medical technicians, they're paramedics, they have other regulatory guidance when they're with patients. Those who work in our correctional facilities continue to be under some additional directives, federal directives from the CDC, and within those correctional facilities, they still have to wear facial coverings and do some other things. And then we have nurses and physicians who work in our clinics and do other work for us here within Orange County. They're going to follow well-established medical protocols in the work that they do. So sometimes you have to look at the specific work category or the employment category for our employee in order to understand what they will be required to do or not. So in terms of our community has to, those who, again, operate businesses, they're going to have to make some decisions about what they're going to do with their employee. Pursuant to the current state of laws, and here within Florida, there's some restrictions there. So I cannot advise them legally what they need to do. They need to look within their own general counsels for advice in that regard. We cannot require them to do certain things, may put certain requirements in on their employees. That is a business decision that they are going to have to make.
Oman Machuca, Telemundo. Talking about the redistricting, what do you have for the Hispanic community in this matter?
Well, all communities are able to give input. So our meetings that are being moved around the county, they're inclusive. We have representatives who are on the redistricting committee who are Hispanic. In addition, we are translating any of the materials or minutes from those meetings in Spanish. Individuals who may want to attend, who may be language challenged, there's opportunities there right at the meetings to have the meetings, the dialogue translated. So we're pretty inclusive here within Orange County. And so even, we have a broad array of people who live here, Haitian Creole, we have a significant population there, even the Asian community, various diasporas there, and languages are spoken. So we use our staff. Ms. Ilia Torres is one of my special assistants. Of course, she is there to be a liaison within the Spanish-speaking community. But we also have liaisons in the Asian community who speak different dialects, Chinese, etc. So that's what I would tell you. So Orange County, I think, is a leader in that regard in terms of being diverse and inclusive in our processes. So we were intentional about making appointments of individuals that represent, all segments of our community and not just one.
Emily Braun, News 13. This is for Kent Donahue. You mentioned that there were 34 new deaths since the last time we met. Were any of those pediatric cases?
Actually, the range was 35 to 100 years old. There you go.
This is Melissa Thomas with Florida National News. I did want to get, this is for Mr. Donahue. I did want to find out, have you seen an increase in vaccinations now that we've heard about vaccinations being available for those ages 5 to 11? Have you seen an increase in Orange County in those vaccinations?
Looking at the numbers right now, I'm not sure if it's reflected in our data, so I don't think so at this time, but certainly we can maybe respond in maybe week 2. We might see that represented in the data, though. All right?
Steve Hudak from the Orlando Sentinel. Sorry about that. Mr. Mayor, it's been a pretty eventful 3 months. We've had 2 of the highest death months. September was 293, August was 410. I'm wondering what stands out to you over the last 3 months? What kind of things, we had the governor threaten to fine the county. What stands out in your mind?
During that 3-month period of time, we lost a lot of people. There were a lot of funerals. As human beings, there are always funerals. But we were at a critical point. I had the opportunity to, every week, I attended a funeral somewhere, and I had the opportunity to talk with our funeral directors. They were at a critical point in many ways where they were out of space for storing bodies. And they had to make some significant adjustments. When we think about our loved ones who pass on, you want them to really be dignified in those last closing moments with their families, and in some ways may not have been as dignified as perhaps it was. There were families who could not go into the hospitals and visit like they wanted to because of COVID-19 restrictions in the hospitals. So some people didn't get the closure that I think they were looking for during that process. We can't ever go back and change that for them. So that's remarkable to me. It is remarkable that we had a lot of noise in the community about the efficacy of the vaccine. We had opposing viewpoints that created controversy and conflict in our community. But I remain focused on the mission and our strategies to reduce the spread of the virus in our community. We did that. We increased the rate of vaccinations within our community, where we had plateaued. And if we had continued to do the same thing, I don't think that we would be where we are today. So we wanted different results, so we had to do something differently. And that is the blessing that I have to be the Orange County mayor today, coming to our citizens with an abundance of crisis management experience. So, you know, I've asked our community over decades now to do certain things, to take certain actions to protect themselves from calamities, from a crisis. And so I want this community to know I'm the same man who has told you when we were dealing with terror attacks, hurricanes, floods, barricaded gunmen, lost children, abducted individuals, fires, shootings, and various other critical incidents over time where I've had to stand in this community and give people direction to keep themselves safe. Sometimes to even rescue individuals who didn't want to live. And so it's a privilege for me to serve at this time and use the sum total of all of my experiences over this 40-plus years to lead. So there were some leaders in our community who stepped up to the plate. I think the school district went against the grain when there were people who didn't live here were making decisions about people who live here, you know, people who live in Tallahassee and other places. But those same people haven't been on the ground here when the going was bad. It's remarkable to me that this whole dynamic has been so politicized. In the last 3 months, it probably got more politicized than it ever was. And that's a shame. So how do you argue with the decisions that we made when we were trying to save lives, protect lives of our own employees, dealing with our own circumstances right here in Orange County? When people dial 911, they call the men and women here. You know, the corrections officer who was funeralized today, I consider that corrections officer one of the heroes. You know, just a year or so ago, he was involved in a crisis situation at the jail, in which some employees at the jail were taken hostage by an individual who was able to take a gun into the jail. Yeah, the heroes in this community, I salute them. I will do that every day. You know, I've been on the ground over the years as a first responder, and I don't want people to forget that. Not many people can tell you that. At all levels, making some critical decisions, I know what I know about crisis management, and so when we have this insertion of outside influences into these circumstances that we've had to deal with, remarkable to me. So I can go on and on. I'm going to get off my soapbox here about it. So yes, it was, Steve, disappointment there in some of the rhetoric that I heard in these last 3 months. All right, other question?
Just one question was texted from Scott Powers with Florida Political News. His question reads, Mayor, why does the executive order expire at 3? What is holding you to that time?
The previous executive order was signed at 3:04, so it expires. I'm just going to let it expire rather than write another executive order to say it expires. I'm just going to let it expire. Okay. So thank you all for joining us. The next news conference is scheduled for Thursday, November the 4th